I'd like now to introduce Senator Rivera, who is the chair of the Health Committee for the Council of State Governments East, who's going to be our moderator for the event.
Good afternoon to everyone. Again, my name is Gustavo Rivera, State Senator for the 33rd District in the Boogie Down Bronx. There you go. We were just discussing the wonderfulness that is Arthur Avenue in the Bronx, some of the best pizza in the Bronx. Also, Two Boots, as it says there, and Brothers on Staten Island. Ain't been to Brothers, but Two Boots is excellent. Now, we would obviously be meeting in Ontario, and maybe Ontario has good pizza. I have no idea. Maybe they do. Maybe there's some Ontarian thing. I'm sure that that's what you call it. But we are obviously not in person because of this pandemic. I am hoping that every single one of you is vaccinated. I am House Moderna myself. And we can hopefully we can encourage our colleagues, friends, family members, neighbors, and everybody else so that we can actually get to the other side of this thing. We're still not there. But in any event, I am glad to be here. This is obviously a session that for the Council of State Governments. Today we were talking about age-friendly states and improving the health and well-being of older adults. And it's particularly important since in the East region of the Council for State Governments, 10 of the 12 oldest jurisdictions in the United States. In other words, the folks who are of these jurisdictions, 10 of the 12, where most of these folks, most seniors live in the United States, are in this region of the country. So obviously it is an important issue that we need to talk about. And particularly considering that most people who are over 50 are folks who want to remain where they live. And so we need to be thoughtful about what we do to make sure that we can create environments where they can remain where they want to remain, and then where maintain themselves in a healthy way. So we are joined by a very esteemed panel. I will briefly introduce all of them, and then they will kick it off. And I will be coming back to kind of ask some questions, and we'll make sure to get some questions from you. As Shirley said earlier, if you are not speaking, please put yourself on mute. But once we get to the question and answer part, you may want to mute yourselves. You should do so there. And you can also ask questions on the chat. I will make sure that we get to them at the end. So it seems these are some of the folks that we are joined by. First of all, Dr. Carrie Fulmer, who is not only the president of the John A. Hartford Foundation in New York City, but has a lot of letters after their name, whether it's like a PhD, RN, FAAN, many. I salute you, madam, because I don't even have, I don't have any of those. Supposed to have PhD, but didn't. So the John A. Hartford Foundation is a national philanthropy dedicated to improving the care of older adults. She served as the chief strategist for their foundation. And also she is an elected member of the National Academy of Medicine and recently served in the Independent Coronavirus Commission for Safety and Quality in Nursing Homes, an incredibly important series of conversations that we're having right now. She served previously as the Dean of Health and Science of Northeastern University and a founding dean of New York University College of Nursing. So Dr. Fuller has done a lot, and we are very, very honored to be having her today. We are also joined by Commissioner Kimberly Causey-Gomez, who was appointed by Albert Bryan, the governor of the Virgin Islands, the United States Virgin Islands, as the Commissioner of Human Services in October of 2019. She's a licensed certified social worker with over 30 years of volunteer and specialized professional expertise in human services work. We are very glad to be joined by Commissioner Kimberly Causey-Gomez. So thank you so much for being with us. And we have two more folks, Mr. Mathew Varsava, or Varsava. I believe it's Varsava. Is that correct?
It's Varsava.
Varsava. So put the accent on the second A, folks. He is the Director of Policy for the Ontario Minister for Seniors and Accessibility. Do they have good pizza in Ontario?
Of course, we have good everything in Ontario.
Okay, very good answer. I'm not sure if I believe you. It's probably just okay, but that's fine. They probably have a lot of great stuff out of Ontario. And one of the great things that they have is Mr. Varsava himself, who has previously served as communication and stakeholder engagement roles for Ontario Public Service. And before joining the public service, he was a senior director of sales Americas for an IT manufacturer, and has a Mathew has completed an undergraduate degree in philosophy and political science from Western University, project manager certificate from Humber College, and is currently pursuing a master's in business administration for the University of Illinois. So welcome, Mr. Varsava. And last but not least, my good colleague, my great colleague, and I'm very glad that she was able to join us, and that is Senator Rachel May, who represents the 53rd District and is the chair on the Committee of Aging, as well as a Legislative Commission on Rural Resources. And she is, and I should tell you, not only that she knows perfect Russian, which is actually a fun thing. If you want to ask, she actually taught Russian literature. And I'll linger on this for a second because she's exactly the type of person that I believe that we need in public service, somebody who saw the need because of the person who was there before her, who I will not mention, but she beat this person and she has proven to be an invaluable member of the state Senate. As somebody who is, she's an upstate person, represents rural parts, as somebody who sincerely believes that cows might attack in farms, which she obviously shook her head and told me I was just being stupid. And I was very glad that she did, because she brings all of that to the Senate, and particularly around aging issues. She has been absolutely a leader in the conversation that we've had in the last year about how to make sure that we keep people in nursing homes healthy, we keep families coming to visit them. I mean, just all in all, I'm incredibly happy that she's able to be with us today. That's Senator Rachel May from the 53rd District in upstate New York, in Syracuse. So that is the great lineup that we have for you. But now I will get out of the way and we'll let Dr. Fulmer present, and then we will hear from Senator May and the two other folks, and then we will have a discussion and a wrap up. So Dr. Fulmer, take it away.
Thank you so much, Senator Rivera. And it is such a privilege to be with all of you today. I can't think of a more important audience for me to be speaking with today, because you are the people who help change policy that makes the world become age friendly. And I'm going to make several points. I'm going to invite you all to be a part of our age-friendly social movement. So our foundation, Johnny Hartford Foundation, next slide, is dedicated to improving the care of older adults. And we do that no matter who's giving the care and no matter where the care is being given. So we do that through our priority areas of creating age-friendly health systems, because when we started, there really weren't any. Supporting family caregivers, those 40 million people out there who say, what do I do now? And improving serious illness and end-of-life care, which should not be conflated. Serious illness might be, for example, dementia, and end-of-life care obviously is different from that. Next slide, please. Why do we need these solutions? You will know that the demography is very clear. The greatest success story of the 20th century is aging. Isn't that wonderful? We've doubled our lifespan. Now we have to double our commitment to those older Americans and Canadians and everybody in the Council of State Governments. Complexity, multiple chronic conditions, dementia, disability, social isolation, and all of the effects of the social determinants of health weigh very heavily on the well-being of people. And I need not tell you that if you happen to be an individual of color living in a nursing home during the pandemic, you did poorly compared to your compadres who were not in that category. Disproportionate harm. Well, older people have higher rates of healthcare related harm, discoordination. I'm looking for all of you to start nodding, and poor preparation for disasters. How could it be that we could go through Katrina and then go through Andrew and then go through the pandemic and say, gee, I wonder how that happened. Come on, we can do better. Next slide. So New York, I'm going to use an example. I'm from New York, and there are some New Yorkers on my panel, which isn't why I'm doing it. I'm doing it because I could take any state and make it an example, but New York is my home. I love it. And so let's talk about our profound demographic changes, and it's all going on among all of you. So there are more residents age 65 plus in New York than the population of 21 other states. That's a lot of older people, 3.2 million people over 65. And 1 in 6 New Yorkers is 65 plus, and the population growth is driven by older adults. And every state is different, but all are aging. Maine will tell you that they are the oldest state if you do the mean age, but this is one that talking about sheer volume. So the population growth there you see from 07 to 17 with quite dramatic increase in the number of older New Yorkers, and also older immigration population. We love them. We cherish our immigrant population in our state and in our country. And what I would say is that that is a really important number to watch as well. Next slide, please. I want to leave you all with saying you demand an age-friendly ecosystem. That's what you're going to say when you're done listening. So we need an age-friendly ecosystem and cross-sector collaboration. In 2006, WHO said that we should have age-friendly cities. I agree with that, and wonderful people were leading that. Alex Kalachi, 2012, AARP became the U.S. affiliate for age-friendly cities and communities. 2016, the John A. Hartford Foundation with the National Area Agencies on Aging started our Aging and Disability Institute. 2016, we started our Age-Friendly Health System movement with the Institute for Healthcare Improvement in Boston, Massachusetts. And I'll show you a slide on that in a minute. In 2017, we began working with TIFA on age-friendly public health systems. And here are the states designated as age-friendly by AARP across the bottom. Just to give you some grounding, I'll try to ground all of this in our geographic location in the Council of State Governments East. Next slide, please. So let me first talk about the ecosystem includes all of us. An age-friendly health system is a part of it. I always say you cannot possibly be an age-friendly city if you don't have an age-friendly health system in your city. And I am positive that's true. So we started working on this and we got experts and leadership to talk about how we would create all care that would be age-friendly and equitable. And it's guided by an essential set of evidence-based practices. All the science is very clear, but as you know, we often have difficulty getting science into practice. So we said to these experts, okay, let's get this to its bare denominator of 4 things. What matters, medications, mentation, that's your mood and memory, and mobility, the 4M framework. It took off like lightning, and we now have I'll show you a map with our over 2,000 locations of care. Why? Because it's simple, people can remember it, and they also understand that all of these 4Ms are interactive all day long. If your medications are off, so will your mentation, probably your mobility, and you won't be able to get to the most important M, what matters. So we work on this consistently, and it's guided by evidence, causes no harm, and it's consistent to the goals and preferences of older adults. And this is with the Institute for Healthcare Improvement located in Boston and a global organization. Next slide. Well, here's our goal met. We said that we would be able to be in 2,000 locations of care by now, and we've beat our numbers. We're in over 2,300 around the country and around the world. Australia just decided that they are going to be 100% age-friendly health systems. And if you look at the graph there, we've tried to count for you the number of age-friendly health system participants already participating from your regions. And so we think that's really important. We want to see those numbers up. My phone number, I want it on your speed dial. Next slide. So age-friendly care is also important in emergency departments. So our foundation, and by the way, our money's from A&P grocery stores, that legacy of John and George Hartford, we have funded a growing initiative called Age-Friendly Emergency Department Care called JED A and JED C. So JED A is the geriatric ED accreditation, 3 levels from the American College of Emergency Physicians, and then our Geri ED collaborative, where there's training and education and all of this research around the 4Ms. And we have webinars and journals and clinical curricula. And there you are. If you look at your lineup, you see the numbers there as well. So we're gonna have to be making a phone call to Vermont, but we really are pleased with this momentum. It is so important. Next slide. Another on-ramp, as we call it, to age-friendly ecosystems is our surgical verification program, the Age-Friendly Surgical Care Surgical Verification Program. We work with the American College of Surgeons in Chicago. It's a national organization creating standards. How many of you know of a surgery that went wrong for an older person? You all do. And so if we have verification and if we have educational modules, and by the way, shout out to Rochester, New York, first verified hospital, Unity Hospital, this we can do. All the data are there, all the mechanisms to get your community doing geriatric surgery verification is available to you. And all of these resources will be made available to you, and you can find more on our website. Next slide. Another, what we call on-ramp, is our age-friendly public health system work. And we, as you know, this country has really gutted the public health system over the past 30 years, and it's time to get it back fast. That's why COVID has been so disastrous. And our vision is that every state and local health department will promote equitable health and well-being and conditions in the home and community that foster good health for older adults. What happened is we developed AAAs, Area Agencies on Aging, and we also have departments of health. And if you get those two groups together, they spend most of the time saying to each other, I had no idea you were doing that. I had no idea you were doing that. So we started in Florida. We were hoping to get 37 counties, and we got like upwards of 50. And we created models for that state. And we now have a growing number of states who are on board and working on their certification for age-friendly public health systems. Across the top, you see the states that are leading right now. And we're very pleased to see that this is without even advertising. We want every state to have age-friendly public health. And the initiative is very promising. Next slide. New York is an age-friendly example. In 2017, New York was recognized as an age-friendly state, recognized by AARP, very important. The governor, state of the state, in 2018 said that they would have 50% of health systems becoming age-friendly in 5 years, and they're on track to do it. We work with the Department of Health in New York all the time. In 2021, there were 149 hospitals and practices that are in the age-friendly health system cohort. We're working with Haney's Hospital Association of New York State, 34 accredited Jerry EDs, the first Jerry surgery verification, and the first state of health department to complete 10 actions and become the age-friendly public health systems recognized program. So how can your state accelerate its age-friendly momentum? I urge you not to think of it in silos. Do not think of one program versus another. Think of it as an ecosystem where every waste no will, whoever raises their hand, bring them in, and we'll find a meaningful role for them. Next slide. In closing, please see us as a trusted source and partner in your work to spread age-friendly care. We work nationally and we influence globally, and we're here for you, and we want to listen to you, and we hope that you will make our work better. Thank you so much. Let me turn it back to our esteemed moderator.
Thank you so much, madam. I should say Dr. Fuller. Just as I said, many letters, and obviously the expertise is there. Thank you so much for that. Next, we will hear from my colleague in New York, Senator Rachel May, again, the chair of the Aging Committee, and somebody who has been, who will be making sure, particularly now that we will have a new governor. I won't go down too much to that rabbit hole, but do get at me at some other time if you want to hear everything I have to say about that issue. But now that we have a new governor, there will be so many opportunities to make sure that the things that we are supposed to do in the state, we actually do. And I know that Rachel is going to be right on top of it. So, Senator May.
Thank you, Gustavo, and thank you, Dr. Fulmer, and everybody who's on here. This is a really important discussion to be having. I am delighted to be here, and I want to share the progress we've been making on behalf of seniors in our state and point to the work that we still have ahead of us, which is monumental. Let me first start by saying that this vital work is done in the context of ageism, which is so prevalent in our culture, and left unchecked, it leads to social isolation, to poor health, to early deaths, and escalating costs. And we are lucky to have leaders, researchers, and advocates like all of you who work to make positive change to improve the quality of life and not have seniors be invisible in our society, which is sadly the case so much of the time. I'm proud that New York was recognized by AARP and WHO in 2017 as the first age-friendly state. We have an Office for the Aging, NYSOFA, which launched something called the Livable New York Initiative with the goal of spreading age-friendly policies all across the state agencies. So affordable housing and inclusive zoning were seen as aging initiatives. Transportation planning was directed to consider things like complete streets and accessible public transportation as age-friendly accommodations. They're also good urban planning. So all together here in Syracuse, our population grew in the last census because of more millennials coming and staying in Syracuse. And I think it's because in doing this kind of age-friendly planning that is also just people-friendly planning. They've also been trying to provide resources to communities, data, tools for planning, coalition building, and a mobile app for people to connect with all the resources that are out there. The Age-Friendly Health Systems Project has used the social determinants of health as guidelines for health.
Friendly, improving health and well-being for older adults.
I will actually ask everyone, I'm sorry about this for a second, Senator May, if everyone can hear themselves. Francis Galinas in Ontario, can you hear us? Francis Galinas?
I just muted them.
Okay.
Yes, I can hear you just fine.
Okay, because we could hear you as well. If you could actually.
Oh,
mute.
sorry.
No worries. Senator May, please continue.
All right, I'll keep going. Yeah, so hospitals have been encouraged to develop geriatric emergency departments. The GEM Center, Geriatric Emergency Medicine, I think it is, at SUNY Upstate in my district is a flagship example. And NYSOFA has also supported NORCs, which I don't know if they exist outside of New York State, but it stands for Naturally Occurring Retirement Communities. So a high-rise apartment building in New York where a lot of people moved in at the same time and they've all been aging place together. Suddenly there's a critical mass of people who can use a nurse and a social worker and programming for seniors. And if we use those kinds of settings that naturally occur, upstate, you see it in some housing developments in inner suburbs as well. So those are exciting things that NYSOFA has done. They've also had an Aging Innovation Challenge that brought together students and private industry and NYSOFA and DOH, and they developed some cool inventions like the GripMate, which is the hand device that allows users to grip eating utensils and writing implements and personal care items, and an inflatable seat cushion that supports mobility by helping the user move from sitting to standing positions. We also have some 19 communities that are part of the global network of age-friendly communities. In Tompkins County, where Ithaca is, the AgeFriendly Ithaca plan works to fight age-based discrimination in the workplace and promotes multi-generational, sorry, my computer froze, just a sec. Sorry, multi-generational social opportunities to encourage a culture of respect and inclusion. In the legislature, we've passed some bills that also support seniors who are trying to stay active longer with trail maps in our state parks and efforts to support senior entrepreneurship, for example. So the AgeFriendly designation in New York isn't just window dressing, but I do have to say, like many of the outgoing governor's initiatives, it is far stronger on checking the boxes that are pretty easy and inexpensive to check, and woefully inadequate when it comes to making the real investment that is necessary for a truly age-friendly state. NYSOFA has a very energetic and creative director, and Greg Olson, and he has done a lot on a Spartan budget to provide in-home services to the elderly, oversee the long-term care ombudsman program in nursing homes. He's even offered animatronic pets to seniors who've been shut in or isolated during the pandemic. And all of these have been great initiatives, but the last thing for NYSOFA shows a lot of the initiatives that check the boxes under age-friendly states have not actually been updated since 2018, like the mobile app. So, you know, they're of limited use, sadly. And most importantly, it's the big ticket items, which don't fall under NYSOFA, they fall under the Department of Health. And despite the Herculean efforts of my colleague, our esteemed Senate Health Chair, Gustavo Rivera, we are very far from making the investment required to be a truly age-friendly state. New York was the only state to cut the Medicaid budget last year, and we did it just as the pandemic was bearing down on us like a freight train in April of 2020. So we have to refocus on a couple of priorities. The first one is aging in place, and the absolute sine qua non of aging in place is a robust home care workforce. New York not only doesn't have that, I know everybody is struggling for workers right now, but in New York, the Medicaid reimbursement rate for home care workers are lower than the minimum wage for fast food workers. So to recruit people to be home healthcare aides is almost impossible. Worse than that, we had a hearing last month about the healthcare workforce, the long-term care workforce. And what we heard about wage theft, about people working 24-hour shifts for 13 hours pay, about home health aides who had to swallow the cost of lengthy interruptions in their work schedule when a client went into the hospital or died, when they just were out of work until they got another client. Those kinds of issues really devalue our workforce. I think the key to treating seniors with dignity is treating the care workers with dignity. And that's why I've been working with my colleagues and AARP and lots of advocacy groups to put forward solutions, including a significantly higher minimum wage for home care workers and a tax credit for family caregivers to recognize the invaluable services that family members provide. And we've also proposed a shift, and I think this is something I would like to see other states think about too, a shift in state economic development policy to recognize the fact that if you invest in home care, you're investing in jobs, and there is a very large economic payoff to keeping seniors out of nursing homes, keeping workers out of poverty, and helping family members stay in the workforce instead of having to stay home and care for their loved ones. So we're working on those. We're working on some other priorities as well. We passed Senator Rivera's legislation this year to set minimum staffing levels at skilled nurse facilities, which was long overdue. We have to do more to support our critical access hospitals and our rural hospitals. And I have introduced legislation to try to help with recruiting and training geriatric specialists, which is a major challenge right now. They are sadly few and far between, and it's not an area of specialization that medical students think about going into, really, which is partly due to economics and partly due to ageism, I think, in our culture. So we have a long way to go. I am very hopeful, like Senator Rivera, that the incoming governor is going to make the caring economy a priority. I know she has a strong focus on childcare, and she's been to my district several times just in the last couple months to visit childcare facilities and talk about childcare funding. And every time she's come, I have raised with her the parallel issue of elder care, and I think she truly gets it. So I'm hopeful that we will have her as a partner. And in New York, for those of you who aren't familiar, the Constitution is such that the governor has power over the budget as well as a lot of other things. And so having a governor who gets it about the caring economy is going to be really important. So in addition to her, I am grateful to all of you who are lifting up the age-friendly banner in the context of a culture that tends to want to make seniors relatively invisible. So thank you for all you do. I really hope we can work together moving forward and move the needle on these issues.
Thank you, Senator May. See what I told you? I'm very glad that she's the one that actually has the ear of all of us. And certainly, as she just mentioned, we all have the ear of this new governor. So there will be a lot of great work that we need to do in the next couple of years, but I'm very much looking forward to continuing to do with Senator May. Thank you for that, madam. Next, we will hear from some folks from different parts of the region, which are not the United States. So we will start north and then head south. Certainly, as I said, last but certainly not least will be the Virgin Islands. But first, we will hear from Mr. Mathew Varsava. As he corrected me earlier, the accent is on the second A. From up in Canada. Mr. Varsava, tell us how things are going over there.
Well, thank you very much, Senator Rivera. I'll share the deck here that we have. And of course, as you have both your shots, as you mentioned, you're welcome to come north of the border to try our delectable cuisine anytime you want. We'll gladly take your tourism dollars up here. It's a pleasure today to be able to share some of the initiatives that the Ontario government has on the go to help create more age-friendly communities all across our province. It's a pleasure to be here with each of you and to, of course, follow Senator May and Dr. Fullerman. And because so many of the things that we're going to talk about align with some of the great things that they brought up. Quick facts about Ontario for those who may not have been across the border. As we said, we'll gladly bring you up here with your tourism dollars any day of the week. Ontario is a pretty big province, as you can see here, over 415 square mile, 100,000 square miles. You'll notice that we used Imperial for our friends south of the border. That we have about slightly over 14.5 million inhabitants. We have a wide diversity of languages. Only 69.5% of Ontarians have English as their primary language. So it does raise some considerable things that matter when we're talking about how to service seniors and how to meet seniors in the way that matter to them, that we'll talk about in a sec. And that directly relates to the fact that we have over 16 languages that are spoken by at least 140,000 inhabitants in our province. And part of the reason why I have this particular map on here is to really demonstrate the difference between Northern and Southern Ontario. So this is a density map. You can see that the vast majority of the population in Ontario is concentrated in the southern end of the province, appropriately enough, not too far from Senator May, versus in Northern Ontario, we have extremely low densities. So that raises considerable challenges when we're talking about how to develop age-friendly infrastructure, as we'll chat about in a sec. And as has been mentioned, the silver tsunami, as my boss, Minister Raymond Cho, would say, is coming. That in Ontario, we're currently adding approximately 100,000 seniors, excuse me, every year to our provincial population, which is an ethnically and linguistically diverse group. And of course, that there's a couple of other interwoven factors. One is the projection of how much of our population will be seniors, approximately 30% in 20 years. And of course, that accentuated by COVID, our seniors population is extremely tech savvy, even where they were 2.5 years ago. And that really matters when we're talking about what kind of services need to be offered to meet seniors in the way that they want. Recently, we have surveyed our senior population in the province to say, what are the things that matter to you? And this particular element, the idea of talking and garnering feedback, is something that we're going to come back to as we're talking about a key factor that we've been leveraging to try and develop more age-friendly and appropriate infrastructures. So when we're talking to seniors, we found that 2/3 of them continue to see themselves living in their community over the next decade. That 1/4 of them are talking about the fact that the housing options that will be available to them based on their needs just don't feel affordable to them. That half of all of our seniors are worried about their safety, and that's both physical safety, emotional safety, financial safety. It's more than just, do I have to worry about whether the security elements, whether we're talking police services, are available to help keep me safe. It's about, do I feel safe? And of course, that half of our seniors are looking at how they can continue to be involved in their community, whether that's working as long as they want to, or as being a considerable source of volunteer, lack of a better term, volunteer labor in our nonprofit sector all across our province. Fun story related to that, my dad retired a couple of years ago, and my mom jokes that he has never been busier than he is now as a volunteer with Habitat for Humanity. So I see it firsthand all the time. And so really, this leads into how our province is looking at the way of developing age-friendly infrastructure. That really it's about empowering seniors and their families with choice. And part of that is meeting residents in the way of their choosing. And that's in a mix of things. So it's about giving information in the language of their choice. One of the things that's been suggested is that, especially for people who have English as their second language, that as they get older, their comfort in English diminishes. And therefore, being able to offer access to information about services and services themselves in the language at which seniors feel most comfortable really helps break down some of those barriers that can cause significant issues for seniors. The other is being able to meet seniors in the format of their choice. You know, as I mentioned, seniors are significantly more tech savvy than they even were 3 years ago. My mom puts me to shame when it comes to Facebook. It's about communicating in the style that fits them. You know, I mentioned the fact my mom is big on Facebook. I don't particularly use Facebook, but it's understanding the communicative style of the folks you are trying to reach. Some people want something in a newspaper, some people want something on a radio, some people leverage Facebook. It's understanding, appreciating, and trying to respond to our greater seniors audience in the ways that make them feel comfortable. And of course, part of that is recognizing that one size doesn't fit all, that it's about customizing supports with local partners that really enable us to give the most responsive systems possible. And that leads into some of the pillars that our government is looking at when we're talking about our strategy for an aging population. It's about, again, empowering seniors to live in their communities, whether that be at home or in the broader community, as long as they wish. About helping them remain socially active and physically active, about helping them continue to feel safe and secure, and about helping them be able to participate in the labor market and the economy as long as they want to. And we really feel that helps us achieve some of those key goals that Dr. Fulmer was talking about earlier, about helping our 55 plus adults stay healthy and safe, stay active and connected, feel financially secure, and again, be able to live in their home as long as they choose. So when we're building age-friendly infrastructure, Ontario has built and updated recently our age-friendly community guide to help our municipal partners and local community organizations create and sustain age-friendly infrastructure. And it's important to remember that age-friendly infrastructure doesn't just mean the wonderful examples that Senator May brought about how we can have accessible buses and have ramps and physical infrastructure that fits. That's incredibly important. And she made some great points about how age-friendly infrastructure is people-friendly infrastructure, a fantastic point that we believe in as well. It's also about creating and sustaining social infrastructure to help create those network of supports that help our seniors be able to remain in their community. So that as their needs evolve, whether that be because of medical condition, whether it be because of psychological condition, whether it be because of physical need due to mobility issues, that the infrastructure is able to evolve to meet those needs. And this is the format that we use in terms of helping seniors age in place. That there's a constant need to define what those local needs are, to assess how we can meet them, to develop action plans, to implement those action plans, and then most importantly, to be continually going back into the communities that are being served to say, is this meeting your need? Where are those gaps? How can we continue to evolve the services to meet those needs? Our Premier, Doug Ford, is a big believer in the lean methodology from project management. And whether you like lean or whether you like Scrum or agility or any sort of format, one of the key parts of it is iterative change. Big changes are great, but if you can keep the ball rolling, then you can keep using the momentum to continually develop infrastructure that continues to meet those needs. And that's a key part of the approach that we take when we're talking about services. And the other key part to that, and this was a great point that's been brought up, is that nobody can act in a vacuum. It really is about building communities of advocates. And that means working with other layers of government, with local community organizations, with care providers, with the various support networks. That means family, friends, your pastor, as an example, all those pieces that come together. We often hear the analogy that it takes a village to raise a child. It also takes a village to keep the village together. And that means supporting the needs of our seniors as well. But it's really important to be able to build that information sharing infrastructure to provide those iterative local supports that are needed. So when we look at the Age-Friendly Communities program and how we've tried to sustain it as a province, we really, again, focus on trying to drive both physical infrastructure and social infrastructure. And part of that is really trying to drive sharing of best practices, which is how we use our age-friendly community guide. And at the end of the presentation, I have links to all the programs I've talked about here. So if you have any interest in doing a deeper dive, we'll gladly have further conversations, and you can find links to all these. We have an updated age-friendly community guide that creates and walks through all the different steps that we outlined in the circle earlier. And then we've layered onto that an inclusive community grant program where we directly fund municipalities and community organizations to help them determine what those gaps are. So one little example, it's a great story to share because our minister is actually in this town today, or in the city today, is the City of London, in our case, we have a London, Ontario too, was trying to figure out why weren't seniors using the parks more. They had put in brand new asphalt for all the paths, they're beautifully lit. They said, why aren't seniors using the parks? And they used this grant to do a survey of the senior population in the city. And one of the things that they found was that when they had removed benches because they were getting broken by vandalism, seniors didn't want to use the parks anymore because they needed to rest more often. And that grant allowed them to identify the gap, fix it by putting in more benches, and then confirm that that helped enable that infrastructure to fit the needs of their local seniors. And that's a great example of how we think you iteratively look for those gaps. And it's never perfect, but it's always that attempt to make it better every single time. We've layered onto that the idea of helping to support local community groups to deliver programming. And during COVID, that's meant being able to deliver virtual programming, both phone-based, Zoom-based, and our seniors community grant program last year enabled over 188 local organizations. This year will probably be closer to 250 to deliver local activities and programming to support our seniors. And that way, whether we're talking about up at the far north end of the province or down the far south, that the programming can meet those local needs. And then, of course, we're talking about working with multiple layers of government. And we have a strong partnership with the Association of Municipalities in Ontario, working with cities, counties, to try and make sure that we're helping to meet their identified needs to really drive that partnership. Of course, the other piece that goes with that is giving seniors choice. So we've introduced a home safety tax credit that allows seniors to age in their home by receiving refundable tax credits for renovation work that they do to make their homes more age-friendly. This is a new credit that we brought in. Examples could be installing ramps, converting your main floor into a bedroom so you can live in your bedroom, you don't have to go up and down the stairs. But it's really about enabling that flexibility, giving that choice, empowering that choice. And to that end, that's why we've expanded the number of active living centers all across the province. We've expanded home care services so that people can receive assistance in the home if they need to. And then recognizing the importance of mental development and mental activity, which was a great point that Dr. Fulmer brought up. We launched last year the Spark Ontario portal. And while aimed at all Ontarians, it had a special lens for seniors to be able to help them find volunteering opportunities that allowed them to be socially distant if they needed to, meaning they could do it remote or with all the safety procedures put in place. And where we introduced special filters to meet any accessibility channels that they might have, so that accessibility channels or accessibility challenges did not equate losing the connection into your community. We really think that's important to help build those connections. Then, of course, June is Seniors Month, and so we do extensive programming all across the province to really meet those needs. We believe that's exceptionally important to meet those needs in the language of folks' needs. So we've introduced the senior.
Matthew, I'm sorry to interrupt. I just want to make sure that we have time to get to the commissioner. Want to see if you're close to the end there, because we want to make sure that we down in the Virgin Islands.
Absolutely, Senator. This is the last slide.
Gotcha.
So we've introduced a number of services that match the languages that folks are looking for. Through the Ontario 211 system, we provide access to government supports in over 150 languages. And again, it's about making sure that communities aren't marginalized based upon background. We've also included extensive Meals on Wheels deliveries to help bring food and medicine to folks with the needs. At the end of the day, the age-friendly community initiative across the province is about enabling local organizations with tools, enabling our local seniors with tools, and then letting them tell us where the gaps are. And with that, I appreciate your time today. I'll hand control back over to Senator Rivera. Thank you, sir.
Thank you, Mr. Varsava. And as I said, we're covering our neighbors to the north. Now we're going to our neighbors in the south, so far south indeed, so deep south, you got to cross an ocean to get there. That is obviously Commissioner Kimberly Causey-Gomez from the Virgin Islands.
Yes, thank you so much. I am off mute, right? So I'm going to do a quick 4 or 5 minutes because I believe all of my co-panelists here have just really driven hard on a lot of things that we're doing well. And what I really enjoyed so far is the fact that we're focusing on what we're doing, not what we're not doing. And so I really enjoyed that aspect of it. So I really appreciate that perspective. Human services is definitely interesting. And this is going to be something a little bit different that we have. We have a large vision, and I'm going to kind of skip through and go straight to how big we really are. We're the second largest government agency in the Virgin Islands. And so having said that, I have about 700 staff. I'm down 300 from 10 years ago. So we had about 1,000 employees, and now we're down to less than 700 to do more services. We do lifespan of services. So when Rachel, you were talking about little people in early childhood, we do child care, licensing, and Head Start, all the way up through people with disabilities, as well as our senior population. We don't have really a commission on aging that's established quite yet. So our senior services for government-wide are really focused within human services. We also do eligibility. So Medicaid and SNAP all fall within human services as well. So when we talk about a humongous agency, we are the diversifiable, I don't even know if that's a word, but we have all of the services that you can think of within one-stop shop. So I think that that's one of the important parts of it. We are divided by water, and that's really an interesting aspect. So anything we do, we have to cross channels. So St. Thomas and St. John, in order to get between, is a ferry. In order to get from St. Croix to St. Thomas, it's always either by a boat, which takes 2 hours minimally, or a plane, which is 20 minutes. We also have a smaller island, Water Island. So we have 4 islands that we have to take care of. At any given time during a disaster, especially during hurricane season, we always have to talk about it. We're separated by water. So our sister island could be affected. We're still in recovery mode from Irma and Maria, 2 Cat 5s within 2 weeks of each other. So disaster recovery and still trying to serve is very trying at this given time. Very proud to be a Virgin Islander, as I stated before. In 2010, we had a population of about 106. After the hurricanes in 17, I think we're probably down to about 102, 103. We'll know more after the census comes down. But if you looked at it over the 65 age range, it's 14% of our population. So housing, I'm looking at it from a housing perspective too, because we have an extreme shortage of housing in the Virgin Islands. And that talks about the whole lifespan and continuum of care for housing in general. So not just for our senior population, but for the entire population, we have a shortage of housing. The governor, Albert Bryan, and Tregenza Ropes, our lieutenant governor, came up with a healthy housing initiative. And so what we did was we actually got all of our stakeholders together to come together to find out where are we duplicating and where do we need to make sure that we have excellence in serving our most vulnerable populations. Divided into like 4 segments, so youth, seniors, behavioral health, and I think there was one other one. Our senior population was a big part of it. So what do we have really, really well? What we did was we had the stakeholders, we looked at our quality. Someone mentioned the workforce and how we don't have that workforce. We don't have we have UVI, University of Virgin Islands, as a feeder, but we're shortage in healthcare professionals like you wouldn't believe right now. We have 2 hospitals that are short nurses. They're full right now in our ERs. And so if we're looking at as healthcare professionals, we need more of that type, LPNs, RNs, CNAs, in order for us to do that. I found this, and which I loved, is because the senior living spectrum, you have early progression to moderate to the full on what you need. And we don't have all that. So we're having some gaps in some of those areas. So we might do home health aid or homemaker services, which is what we do. We do congregate living, and we also do visits. We do Meals on Wheels as well. So we do the gamut of that. But what's happening is that people are not able to be independent as long as they have, because we don't have enough of the services. And then once they get into assisted living, there's that borderline, are they independent, or are they really needing full on assisted living services? The 2 homes for the age we have, and I'm going to skip down here real quick. When you're looking at age friendly, what we do well is that we do have some cool outdoor spaces, because we do have the beach. One of the things is that accessibility. And so we've created the rollout mats in some of our wheelchair accessible, so our seniors can get in the water for our socio-rec programs. And so we have that on each district. We have it in St. John, St. Thomas, and St. Croix. And Sports Park and Recreation also just recently got some too. So for us, I'm taking COVID out for a minute, just because I have the realization that one day maybe we'll be at to something that has nothing to do with the pandemic. But right now, that's what we're doing. We also have 2 volunteer programs under our purview, the Retired Senior Volunteer Program, as well as our CSEP program, our communities program. It was kind of paused during COVID, and so here we are. Healthcare was mentioned before. We do not have a vivid healthcare system in the Virgin Islands. If you get sick, this may not be the best place for you to be, especially as you're aging. Current housing situation. I'm on the Housing Authority Board. That is my privilege as a commissioner on the Board of Commissions. Right now, we are really down when it comes to seniors. They have a remarkable redevelopment plan that are coming, which will be revised to come up to about 1,000 units, because right now there are only about 337 units. So obviously, if you're looking at it from the 14% like we talked about before, and then how many people that could potentially be over 65 that could potentially need housing, it could be anywhere from 8 to 10,000. And that's a big, huge issue. We also have Medicaid, and the interesting part about Medicaid is about 10 years ago, we had about 8,000 members, and now we're up to 33,000 members. That's almost 1/3 of our population on Medicaid. That shows you how many people would be eligible for low-income housing, which is why we have to have that in order to be supportive in the Virgin Islands. We have 2 homes for the aged, and during COVID, we lost 4 in our congregate living facility in St. Thomas. And it was devastating for us. The oldest member that we lost was 98, and the youngest was 95. And we immediately put into response. Right now, I'm at a 97% vaccination for all of my residents. And I say all because it's not going to be like a New York number. I have 25 in one home, and I have 11 in another. And so since the hurricanes, I'm not able to be at max capacity for that. And so right now we are in the process of doing community development block grant and hazard MIT to do 2 skilled nursing facilities. We don't have CMS facilities right now, and so our goal is to have 2 CMS facilities that would allow for Medicaid patients to come in and our residents, and have 1 in each district. So we're hoping that is a plan. We've got developments, but the Herbert Grigg home in St. Croix is a $61 million project, and in St. Thomas, it's about $48 million. We have some really great nonprofits I always have to talk about because, human services can't do it alone. The government can't do it alone. So our nonprofit agencies step in. This is where I started in 1992 at Lutheran Social Services when I moved to the Virgin Islands. And they have some great senior living and assisted facilities as well as people with disabilities. We also have a few hospice care and assisted living programs too. I'm going to skip right kind of to the gaps and challenges for us. Funding is always an issue. I think everybody always likes to fight over it. So does it go to early childhood or does it go to seniors? And how do you split it, right? Because early childhood is really important in order for us to build a community as we're coming up, but also our senior living, we're living longer. So how do we support our seniors as well? Transportation, you would think that living on an island, we wouldn't need it, but literally it takes a 45-minute drive from Frederiksted to Christiansted and on St. Croix alone. And so it's an interesting perspective when you're looking at it. Our roads are not great, but we do have Vitran, we do have taxi, we do not have Lyft, and we don't have Uber. And so if you're looking at medication or delivery of groceries and that kind of thing, we're working towards that. And we have a few, but not really a robust system. We do have a socio-rec program, our seniors centers, one in each district. However, they've been closed since the pandemic. So we've been doing a lot of outreach and going from that. We're really missing the boat when it comes to memory care and the rehabilitation aspect and healthcare professionals. And there's also an inequity of funding that comes to the Virgin Islands. We are treated sometimes like we're not equal. So we have lots of next steps. Robust nutrition system, build our facilities, increase the lifespan, and diversify. And of course, our motto is always working together to make a difference. And so that will make sure that we have that. So that was a quick and dirty. I just, I wanted to make sure we skipped and we were able to have some conversation, Gustavo. So just want to let you know, that's our governor, that's our lieutenant governor. I'm very privileged to serve under their purview. And so, of course, these are our phone numbers and stuff. If you ever need anything, we'll be happy to do so. We did a quick YouTube video for our budget hearing recently, and it highlights some of the fun things that we did over this fiscal year, and it has great music to it. So if you get a chance, feel free.
Did you gotcha. Did you play? Was it your song perhaps, Commissioner?
No, it is one of my favorite songs though, so you'll have to take a look at it when you get a chance.
We will have to do that. We'll make sure to put it in it's in the presentation. We'll try to put it in the chat. Thank you all. Oh, yes, Shirley. Oh, we can't hear you, my friend.
I just wanted to mention that Dr. Fulmer has to leave right at 3. So if we have questions for her, we may want to start with those.
So Dr. Full, I was gonna do a quick, if there are questions, this is the time to do it. First of all, thank you all thank you for all the speakers. I was gonna say really quickly that there seems to be some general things here. First, that if we, and this is take from Senator May, that there is an ageism that exists, and once we have to accept first that there are a bunch of seniors in our community, and that, as was mentioned by Mr. Varsava, that the silver tsunami is coming, whether you are in a place that has just 100,000 or less than 120,000 people in it, which is my district is 330,000. It was like a little mind blowing right there. Or whether you're in a big state like this, or in a province like Ontario, you will have so many older folks who are coming into the system. So we have to make sure that the policy actually does not ignore them, has them at the center of it, and you have to, and also realize that the policy choices that we make about our older population has an impact on the rest of the population. The conversation that Rachel had about how, because if you have somebody, if we invest in a workforce that can actually take care of the home care workers, for example, can take care of the seniors. First of all, if we focus on maintaining them healthy, then they might not need nursing homes. They might not need home care, right? They can stay independent and living in their own neighborhoods. If we do have them folks that because of physical ailments, et cetera, wind up needing home care, making sure that we can pay that workforce so that those folks themselves can maintain their families while the family members of those elderly folks can actually continue to be in the workforce. It all kind of follows each other. So it's kind of that there was definitely continuity there, I think. So if there are questions for Dr. Fulmer, because I know she's like almost at the door, we're probably going to push it just a few minutes to see it, because there's a couple of quick things I want to ask. But if there's something for Dr. Fulmer, speak now or forever hold your peace.
And I did chat my email in, and I promise you that I'm very easy to find. And I'm just so impressed by all the content today. And Shirley, thanks for having me.
Dr. Fulmer, thank you so much for that.
My pleasure.
We will
We'll see you in Arthur Avenue.
Yes. Oh, you better. I have so many suggestions for you. Anyway,
Okay.
You all, Dr. Fulmer. So we're going to hold off just for a few more minutes. So there's a couple of quick things I wanted to ask about. First of all, as far as did you say, by the way, Commissioner, that you had 700 staffers? It was a 1,000 staff. You had 1,000 folks working for you, and then it went down to 700. But that 700 serves a population of 100,000.
No, what I said was, as 10 years ago, we had 1,000 employees, and now we're down to 700.
Mm-hmm.
We serve a population with our Medicaid members about 35 to 40,000. So we serve about probably 45% of the population.
Gotcha. Because I wanted to kind of get those, again, it's just sometimes.
84 programs is a lot of programs. So we touch everybody's life somehow or another.
No, I'm saying I salute you, my friend. It sounds like you definitely got it down there. But Senator May, I wanted to ask you a quick question, since it was actually something that was mentioned, I believe, by Mr. Varsava, related to volunteers, opportunities that are provided to folks. And I thought that maybe if you could talk for a minute or two about the opportunities that are provided to, what we do in New York related to volunteer opportunities for seniors who might have retired.
Right. There's one program that I'm particularly fond of that is statewide, but most of the funding has come to Syracuse. I think Syracuse is where it's done the most. And it's called the Senior Companion Program. And it's a kind of a wonderful thing with recruiting retirees who then become companions to seniors who are isolated. So it helps both the retiree who's looking for more engagement with the community and the person they're paired up with who is suffering from isolation, and creates these incredible connections between people. And here in Syracuse, when I've gone to some of their events, it's often a lot of the refugee population that comes over here, and they either are the actual volunteers giving the companionship, or they're the recipients, but it becomes, there's a lot of diversity and a lot of interchange among cultures there. So it's a great kind of killing two birds with one stone sort of effort that I think is exactly the kind of thing that you can do with senior populations.
Gotcha. So those are the three quick things that I had related to both the staffing as well as making sure that we talk about the volunteer opportunities, and just underlining that whether you're a policymaker in Canada, in the Virgin Islands, anywhere in the states, or anywhere really, that we need to make sure that we keep aging folks at the center of our policy discussion because of the impact that they have on the rest of the population. So I want to make sure that and I will use, Commissioner, your word of diversiful. We have to be diversiful in how we approach policy. I'm going to make that a word.
I just made it up. I think it should be a Webster dictionary. I think so.
It's a word. It has been spoken by Commissioner Kimberly Causey-Gomez. It is a word.
I make up words every day.
Diversiful. I love it. So listen, so it seems that we are good with questions, that we don't have any questions. So I will say the following. I thank each and every single one of you for being part of this today. And certainly thank Mr. Varsava, Commissioner Kimberly Causey-Gomez, Dr. Fulmer, and my colleague, Dr. Rachel May, who's also, yes, she is a doctor. Dr. Rachel May, although she can't hear nothing, but she can speak Russian, as I stated earlier. And I thank all of you, and certainly thank you, Shirley Gerard, who is a kind of a glue that holds a lot of this stuff together. This lady right there, oof, you can't see what's behind her because of that East thing in the back. It's like she's got piles of stuff that she's making sure that everything runs on time. So I really appreciate it. So with that, I will say thank you so much for being part of this conversation. We will continue the conversation going, and thank you. Have a great afternoon. Be well.
And we will keep in touch.
Yes, we will.
All right.
See you on Arthur Avenue, folks. Take care.
All right. Thank you.